90-day fentanyl state of emergency in Portland came to an end on Monday. Today, the governor, mayor, and county chairperson gave an update about what was accomplished in the past 3 months.
So the issue of drug policy is something that we know people in Portland care deeply about. It came up over and over again as we gathered voices from the community in our Be Seen, Be Heard Portland project. Well, Ezra Kaplan tackled that issue in our initial report and went to the news conference today to bring your concerns directly to those in a position to change it.
At today's press conference, there were a lot of numbers. 52 people involved in the Unified Command, 1,600 outreach contacts in 3 months, and the creation of baseline data to measure future success. But much of their touted success was behind the scenes, breaking down silos and increasing collaboration. After the 90-day fentanyl emergency declaration expired, Mayor Ted Wheeler said there was still a lot of work to be done.
Today clearly does not mark the end of the fentanyl emergency on our streets. Based on what we've learned, we must redouble our efforts throughout the city and maintain the sense of urgency necessary to meet the fentanyl crisis head on.
He stood alongside Governor Tina Kotek and Multnomah County Chair Jessica Vega Peterson as they described what came from the declaration. The shared message: we are working together.
One of the things in the Central City Task Force that we heard from, whether it was fair or not, was the perception that the city, the state, and the county weren't working well together. That's clearly, through this emergency, you can see, and through this conversation this morning, that is not true.
A few of the accomplishments touted by the elected leaders were expanding a partnership between Portland police and mental health workers to help connect people using fentanyl in public with treatment services, establishing a daily 8 a.m. call between a variety of stakeholders across the city and county to improve efficiency in responding to changing needs, and holding a fentanyl summit with 150 community partners to encourage collaboration and coordination. Their work comes as the state prepares for the recriminalization of drug possession, passed by the state legislature earlier this year.
So in September 1st, our work really is about having a deflection process. One part of that deflection process is going to be having a drop-off center where people can go, they can have intake and treatment, have a peer that can connect with them, and then get connection into services or get direct into services. It is not going to be a detox or withdrawal center, on September 1st, but that is part of the longer-term work of how we can build up the system.
A chronic issue facing the city is a lack of detox beds for those who want to withdraw from fentanyl. Tara Hurst is the executive director of a coalition of treatment providers called the Health Justice Recovery Alliance. She explains that unlike heroin, meth, or crack, fentanyl users need medical detox before being able to start treatment.
You can't take somebody just from the street and put them into residential treatment. They need to start at detox. We are so woefully developed in our detox system in Oregon.
Portland has only 3 detox facilities. The newest one opened last year with Measure 110 funding. There are 106 detox beds in Portland, only half of what the Oregon Health Authority says is needed to support demand.
We needed to start in the Central City. And what you're hearing here today is we've created a great foundation of how to approach it. I know Deschutes County, for example, had an emergency declaration as well. We are seeing challenges all across the state. We're going to look at what's been done here, have some conversations, model it up. It's going to inform how I develop my budget for next year. Work like this is a foundation for more progress, and that means having conversations statewide.
As part of Be Seen, Be Heard, we want you to talk to us. Give us your thoughts, concerns, ideas, solutions, and desires for a better Portland. Go to kptv.com and click on the BSBH Portland at the top of the page. Reporting in studio, Ezra Kaplan, Fox 12 Oregon.